Are you suffering from pain, swelling, and stiffness in the joints of the fingers of the hand? And is it typically more in the morning, lasting for more than 1 hour? And is it going on for more than 6 weeks? Then most probably you could be suffering from rheumatoid arthritis. And are you consulting an orthopedic doctor for this? Then it's high time that you change your doctor to a joint pain doctor or a rheumatologist. Hi, I am Dr. Pradeep Kumar Shenoy, India's first DNB consultant rheumatologist, addressing you from Amrita Center for Rheumatic Diseases. I will tell you for arthritis why you need to consult a joint pain doctor or a rheumatologist and not a bone specialist or an orthopedic doctor. I will tell you first the difference between the two doctors. We, rheumatologists, after finishing our MBBS, get into MD General Medicine training program which spans over 3 years. During this period, we are trained in different specialties like neurologist, cardiology, pulmonology, hepatology, nephrology, hematology, oncology, and even rheumatology itself. But in case of an orthopedic doctor, after his MBBS, they get into MS orthopedics directly, which means that they lack training in MD in general medicine. On the contrast, we rheumatologists have solid training in MD in general medicine. This goes a long way in the management of autoimmune disorders, arthritis, and other rheumatic diseases. Let's see why. Pain, swelling, and stiffness that occurs in the joint in rheumatoid arthritis is called as articular manifestations. But rheumatoid arthritis can involve other organs in the body apart from the joints. It can involve heart, lungs, eyes, etc. For diagnosing this early and treating it effectively, a doctor needs a solid backup of MD in general medicine, which we rheumatologists have and an orthopedic doctor does not have. And most of the autoimmune diseases are dynamic disorders. For example, patients with rheumatoid arthritis can develop an illness called SLE, that is systemic lupus erythematosus or lupus. This overlap between rheumatoid arthritis and SLE is called as lupus. So, picking up this overlap syndromes early and treating it effectively requires solid backup of MD in general medicine. We rheumatologists have this, whereas an orthopedic doctor does not have this. And the disease which I mentioned right now, that is SLE, can be a minor organ disease involving the organs like skin, and it can be very aggressive involving the major organs like heart, lungs, brain, etc. In case of major organ disease, we start very high dose of steroids along with steroid sparing agents. Tapering the dose of steroids and titrating the dose of steroid sparing agents and ultimately keeping the steroid dose at the least possible maintenance dose is an art which requires solid backup of MD general medicine. We rheumatologists have this backup, whereas an orthopedic doctor lacks this training. Lastly, but not the least, arthritis is divided into two: very early arthritis and early arthritis. Arthritis which is diagnosed between the first week and 6th week is called as very early arthritis. Arthritis which is diagnosed after 6 weeks before 1 week, it is called as early arthritis. Very early arthritis and early arthritis are amenable for remission, that is drug-free remission, because very early arthritis and early arthritis are mediated by immature immune cells. They can be easily managed with drugs. So during this period, we can induce drug-free remission in patients. That means patient will be totally off the drugs and the patient will be having no disease. But if the patient consults a orthopedic doctor and comes to us after this golden period, then we miss a golden opportunity to induce remission. After 1 year, inducing remission is very difficult and sometimes it's almost impossible. And patients can miss extra-articular manifestations and overlap syndromes, etc., if they don't visit a rheumatologist at the earliest, and complications can occur. There are very many reasons why a patient with arthritis and autoimmune and rheumatological diseases should consult a rheumatologist and not an orthopedic. More about this I will share in my next video. Please do follow me. Thank you.